Welcome back to Conceive. I'm Milton Michael, joining Dr. Anita, our expert in the field of medicine. Today we are here to discuss on PCOS, which is one of the common illness which is around, and we all would like to know the details with regard to this. We have our expert authority in this field, Dr. Anita, who has an exclusive clinic here in Cochin which takes care of PCOS. And here we have Dr. Anita to explain to us what it's all about. Welcome, Dr. Anita. Here we have a lot many questions, and I, being a layperson, would like to know from an expert what these medical terms imply. Like we've heard about PCOS. It would be kind of if you could explain to us what PCOS is all about.
Well, polycystic ovarian disease, or very commonly known as PCOS, I think almost everyone has heard about this term PCOS, because every other person is talking about, I am having PCOS, she's having PCOS, we are all having problems. So, what exactly is this PCOS? There is a misconception that PCOS is a disease, but in fact PCOS is actually a variation in the normal physiology. So, it's not a disease which comes and it goes. So, it's like a hormonal imbalance which commonly happens in the reproductive age due to the abnormal levels of hormones resulting in certain symptoms. So, that is what exactly is PCOS.
How prevalent is this PCOS? Because as you said, we hear it more often. So,
it is quite common, and some of the studies show that it's around 3 to 20% of all the population. But again, there are some pilot studies, especially done in Southeast Asia or South Asian countries, show that it might actually be going up, and it could be even that 40% of students in the high school might be having PCOS, especially in the urban areas.
yeah, you're right. Why is PCOS, the prevalence of PCOS, increasing by the day? Earlier it was not that much heard of, but now more and more people are coming up with PCOS. Why is it increasing?
PCOS is somewhat a lifestyle disorder. So, we all know that the lifestyle has been changing very rapidly, especially in the last 100 years and more so in the last 20 years. We all know that with the computers and the social media networks, people have kind of changed their behavior. So, PCOS is getting more and more common.
What are the symptoms that you see in PCOS?
PCOS has different types of elements to it. Because of the hormonal imbalance, it does have a lot of reproductive symptoms, and due to the high levels of androgens, there are symptoms due to the high male hormones, and there are some psychological symptoms as well. I will go into the details of these symptoms, but first of all, I feel that in order to understand why these symptoms happen, we need to know the basic physiological changes that happen in PCOS. As I explained earlier, it is a hormonal imbalance. The basic reproductive hormones like LH, FSH are altered in polycystic ovarian disease. Along with that, there is an element of insulin resistance in PCOS patients. So, what exactly is insulin resistance? So, I will try to explain in a simple way. When we take food, in order that the body is able to utilize the food that we eat, the energy is converted from food to energy by the way of insulin, so that all the cells of the body can utilize the food and produce energy. So, the level of insulin should be in an ideal range for the body to function. So, what happens in diabetic patients? Exactly the same thing happens in PCOS patient. When we eat certain type of food, the insulin is released so that the body can utilize it. But some foods like carbohydrates, sugars have a tendency to release insulin in a very high level. So, what happens is that the level of insulin, the circulating insulin in the body gets quite high in PCOS patients. So, what happens is that the cells which are utilizing the insulin become resistant to the high levels of insulin. So, whatever the food is being produced, the cells are not able to utilize it properly because of this instability. So, there is a level of resistance towards insulin in PCO patients just as in diabetes. So, this is just one aspect of the problem. When the insulin levels are high in the blood, it will make the male hormone, which is called the androgen, to go up. I mean, you might think that why male hormone in a female, you know, it's a good question to even think that, you know, why do we have male hormone in female.
Right.
The fact is that all females have a small amount of male hormones in their body. So, when the insulin is high, the male hormone goes up. So, once you know the basic thing going on with the physiology of PCOS, then we will be able to understand the symptoms better.
Do we have any medical prescriptions for these things to cure it?
Yeah, we do have lot of medicines, but you know, there are so many different types of managements which we have to implement before we go into a medical management. For example, as I said, you know, when you come to the reproductive symptoms, when the abnormal level of hormones like LH, FSH happens, what happens is that the regular periods that happen in women because of the ovulation and the regular cycles, they get disturbed. So, resulting in irregular periods. So, what happens is that because of the anovulation, that is the absence of ovulation, the periods become irregular and there is a problem with subfertility or infertility in some women. This might actually happen only in a few women, or it might happen only in a few cycles in a few women with PCOS. It is not necessary that every person has these symptoms. So, this is one of the symptoms is that ovulation is not happening and regular periods are not happening. The other symptom is that the weight tends to go up. Because of all these abnormalities, the weight tends to go up. So, there are some women who have difficulty in losing weight. So, overweight women and obesity is some kind of byproduct of this hormonal abnormality. And as I explained earlier, because of the high level of male hormones, there are some symptoms like the acne. You know, women with PCOS get a lot of skin problems. They get a lot of pimples and acne, the skin becomes very oily, and you know, the hair pattern tends to become more of a male pattern. So, there is more hair growth. It is clinically called hirsutism, because there is abnormally high amount of hair growth in some women, and even the pattern of hair can be like in a male pattern. Even male pattern baldness or hirsutism is found in PCOS.
And facial hair growth also.
Facial hair growth can happen, body hair growth can happen. The other problems with high androgens are because of the high androgens, the behavior can be slightly altered, and there are lot of studies showing that the problems with anxiety and depression are more common in PCOS women. In fact, you know, after the review of all the studies done so far, the guidelines by the Royal College of London and the Royal College of Australia, they have made recommendation that the psychological assessment of a PCOS patient is of highly important issue. So, to combine all these, the symptoms include problems due to anovulation, irregular periods, weight gain, abnormal hair growth, psychological issues, and sometimes in severe PCOS, the skin tends to have problems with darkened velvety areas in the neck. So, some women do have cosmetic issues as well with PCOS in addition to the obesity.
Southend Fertility and IVF, where hope meets happiness. Established in 2001 and guided by care, ethics and expertise, Southend has completed over 10,000 ART cycles. It offers comprehensive infertility treatment for both men and women. Modern facilities and experienced team is the hallmark of Southend. The centers are at Vasant Vihar, Gurgaon, Saket, Paschim Vihar and Amritsar. Southend Fertility and IVF.
This program is brought to you by Southend Fertility and IVF.
How do we manage this on a long term?
Yes, when we think about the long term issues of PCOS, there are more issues than what I have already explained. So, the management, we have to look into the issues. The long term problems include cardiovascular symptoms and cardiovascular diseases like hypertension, dyslipidemia, clot formation in the vessels and cardiovascular accidents can happen in PCOS. The other problems which are very commonly seen in PCOS are type 2 diabetes, gestational diabetes, that is diabetes in pregnancy, and along with that impaired glucose tolerances as well. So, if you have a PCOS person in her young age, what happens is that as she progresses towards her 30s or 40s, there is a likelihood that she might become diabetic as well. So, in order to tackle the problems on a long term, it is quite important that a good assessment should be done at a very early age. So, even if you have a young girl of in her teens, you have to assess them thoroughly. You have to take a good history, you have to assess their blood pressure, weight, family history, check her sugars and check her lipid profile and all those things, so that you know how they are going to progress in future. So that if you find somebody who is in a high risk, for example, if you have a girl who is quite heavy, whose parents are diabetic and hypertensive and they have a history of stroke, you can actually assess her properly at that age, even if she is 16, and avoid her getting all those problems in future. So, it is not just enough that we do a good assessment, there has to be proper protocol for every clinician who is going to meet a PCOS patient. So, in that protocol, if everything is included, a proper evaluation will be done, and then it is very important that we make a management plan. So, what exactly is the management plan? When we come to the management of PCOS in the long term, it is not enough that clinicians or physicians are involved. It is very important that we have a multidisciplinary team involved in the care of PCOS that has to have a dietitian, an exercise specialist, a counselor, in addition to the basic clinician, a gynecologist or even an infertilologist.
Doctor, you have wonderfully explained in detail about how we manage and the symptoms and to take care of PCOS. But could you tell us what do we do to prevent this? As you know, prevention is better than cure. So it would be good if we could know how to prevent this in future.
Okay, so again, when we come to the prevention, we know that it is like a physiological change, a difference from a normal physiology. So we have to look into the factors why PCOS is happening. You know, if you take maybe few hundreds and thousands of years back, probably there would not have been so many PCOS cases. So what is the difference in the lifestyle which has happened over the years? That exactly will explain how we can prevent that. Basically, humans and most of the animals were engineered to be active. We were not, you know, built to be
sedentary
or sitting in a classroom for 8 hours, and then, you know, again coming back home and sitting in front of the computers or doing your homeworks and stuff. You know, we were active many millions of years back. When we evolved, we were extremely active. So what happened over the years is that changed. So we have to change back. So it took so many years for the body to evolve in a particular way. And then we have changed everything suddenly. So it's very simple. We have to get active back.
Get back to our natural
way of life. We are doing, you know, the students might be very happy to hear this, way too much of studying. So, you know, less number of hours of studying, less schooling, more activities. Then there will not be any PCOS.
It should be more studying in the field.
More
running around.
So teachers and schools and maybe even the governments may not be happy to hear this, but we need a drastic change in our lifestyle, not just for the PCOS and all the sequelae of PCOS. And we've heard that what happens after PCOS? You get infertility, you get diabetes, you get obesity, you get stroke, you get heart attack. So, you know, it's huge public health implications. It's a huge. You know, governments are spending millions and millions of pounds on the health care of the people because of this problem. And, you know, we just have, not just have mortality, not just the deaths, you know, the morbidity because of all these things.
The quality of life.
Yeah, I know. See, people say that you're overweight, you have to reduce, but you can't. See, when you're a PCOS woman, people say that you have to lose weight, but you can't. You stop eating, but you're still obese. It's not easy to lose weight when you're PCOS. And you just get depressed thinking about that, you know, you're overweight. That's not the right way to tackle this, because it's a hormonal problem. It is very difficult to reduce weight when you're a polycystic ovarian problem. And especially, you know what we do to our children, you know, we make them eat all the time, we force them to eat, you know, when they're babies, like 1 or 2 years, you just force them to eat and drink, and, you know, you provide them with all the fast foods and all the soft drinks, and then, you know, make them sit. They want to play, but, you know, you don't allow them. Even babies, they want to run around. You know, what do mothers say? No, don't do this, don't do that. So, you know, the kids are not allowed to run around and play anymore. You know, even the babies, they are like, you know, you have to do this, you have to sit there, you have to do this. And then what you do? Then you put them in school. At what age? 2 years, 3 years, they start their preschool. They're not supposed to even start studying until the age of 6 years. So basically, you are forcing this lifestyle on the babies or the kids. So it has to start very young. And then what happens? They're either traveling to school, sitting in a bus for an hour or so. They skip their breakfast because they have to start early. Then they sit in this class for, you know, 8 hours. Then again travel back to home by bus or whatever car. Again sitting. When they come back home, they eat more because they have not been eating properly when they should actually have taken their food. And then what happens? Then they have tuition, right? So you do this to children, you make them obese, they want to play, but nobody is allowed to play. And then, you know, because of the hectic lifestyle that we have now, what do parents do? parents use TV and computer to babysit the children. You know, okay, you put the switch on, okay, you sit there.
A convenient way.
Because, you know, it's very convenient to babysit. They don't get into trouble and you can finish your job. That is a mistake that we are doing. So, you do this to the children, then they become overweight, and then once they are growing up, you say, no, 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 stop eating this, stop eating that. Don't eat fat, don't eat this. You know what they can do? You've already made them so vulnerable. You've already made them
Sick.
in a, in a very, very difficult position, and then they cannot change. They've already put on the fat cells. The basal metabolic rate has already gone down.
Okay.
And then you're trying to change them. You tell them, you know, all the advertisements everywhere, all the movies, all the social media, what do they project? Slim people, okay, healthy, very slim, you know, photoshopped people, and then what happens? They are under pressure.
Mental pressure, body growing big.
No wonder that they get depressed, because it's very difficult for them to lose weight. So, it all have to start early, you know, prevention. They have to start not after their birth or in their childhood. It has to be started when they are in the uterus.
Oh.
The mother, when she is carrying, has to eat properly, healthy food, not fast foods or fatty foods,
Yes.
healthy food. She has to be active and have a healthy weight and be active to have a good blood circulation to avoid PCOS in that unborn child. So, it has to be started very early in the intrauterine period.
Right. As you rightly now did mention about the lifestyle changes which should happen, and towards the end you did talk about the healthy food that the mother should start eating when the baby is right in the womb. Would you please describe what kind of food that the mother, as well as once the baby is born, once the baby grows up, what kind of food should people have to?
The diet of PCOS patient is such a huge topic, and what I'll actually do is I'll do a whole episode on the diet.
Okay.
But as a nutshell, in order to be healthy, it's very important to eat healthy. So, it's not very easy nowadays because of the busy work schedule, and it is quite difficult. But I think you can get around it. You can have small tips and be a little bit cunning in order to try and keep yourself healthy. But healthy eating is quite important, but it will take a long time, and I will do a whole episode on PCOS diet alone.
So, you will help us know how to circumvent this junk food and all those things, and
definitely
we would be looking forward to it, doctor, because that's something which we all need.
Yeah.
Well, to come around this PCOS case.
Southend Fertility and IVF, where hope meets happiness. Established in 2001 and guided by care, ethics and expertise, Southend has completed over 10,000 ART cycles. It offers comprehensive infertility treatment for both men and women. Modern facilities and experienced team is the hallmark of Southend. The centers are at Vasant Vihar, Gurgaon, Saket, Paschim Vihar and Amritsar. Southend Fertility and IVF.
This program is brought to you by Southend Fertility and IVF.
Dr. Anita, you have given us a lot of information with regard to PCOS, its occurrence, its symptoms, how do we manage it, and all these things. We would also like to know, how would you medically manage PCOS?
The medical management of PCOS should come last. So, I would say that the doctor comes last, although I am a doctor. Okay, so, the changes in the lifestyle should precede any pharmacological intervention. What I normally tell the patient is that 1/3, 1/3, 1/3. So, do you want to get better? We have 1/3 of treatment that I can offer you. So, the 1/3 is diet. The second 1/3 is exercise, and the third 1/3
is your part.
Is our part as the doctor. So, anyway, I am discussing about diet and exercise in other episodes. So, when it comes to what a doctor can do, so if you have a young girl in her teens, you would want her to be comfortable. So, you would want her to have regular periods. So, after the lifestyle advices that you do, you would try and give her medicines just to induce regular periods, so that they don't go a long time without their periods, because it does have some implications. Not having periods for more than 3 to 4 months, it does lead to later complications like higher risk of endometrial cancer due to the overgrowth of the uterine lining. So, you would want them to have regular periods, and you can give any type of pill to induce periods. And a major concern among teenagers would be cosmetic, obviously, the skin problems and the hair growth and all that. So, the medical treatments are there for these things, but they are not that effective. So, generally cosmetic treatments like whatever they do in the beauty parlor for the hair removal is actually more ideal than the medical treatment for the excessive hair growth. The other main problem would be when they are in the reproductive age. So, then generally the complaint would be subfertility or infertility. So, they're unable to conceive because they're not ovulating. So, again after the lifestyle modifications, you can give medicines to induce ovulation. Ovulation is a process by which the eggs grow, mature, and they rupture, and and the fertilization happens. So, you have to do something called a follicular study by doing regular scans to make sure these follicles, which are the small eggs growing, are happening along with these medicines, so that you don't give medicine endlessly, because when you're giving medicines for ovulation, it does have some side effects, and they should not be used more than either 6 months or 12 months. So, it's important that you do a follicular study to monitor ovulation, and then you give the right advices to make sure they conceive as soon as possible. Around 10 to 20% of women conceive after ovulation by these medicines. In some women who are resistant to these medicines, you can give some injections called gonadotrophins, and it might result in ovulation. But there are some problems with medicines and injections, like having a multiple pregnancy, because you are making them super ovulate, and then the ovaries tend to overreact and produce too many eggs. So, you don't want to have too many babies. One is good per pregnancy. So, you want to be very careful when you take medicines and injections, because you do find that twin pregnancies or even triplets can happen even up to 40% of women if you give too many injections and medicines. And what happens is that twin pregnancies are more complicated. Complicated in the sense that there are maternal risks, there are risks to the baby. When you look at the maternal risk, the mother can have problems like diabetes, hypertension, bleeding, premature delivery, preterm, lots of problems. So, that is a risk to the mother. So, you don't want to have multiple pregnancies. Then the risk to the baby are much, much higher. There can be miscarriages, loss of pregnancies at a very early stage. There can be preterm deliveries, premature deliveries. For example, if you have a twin pregnancy, your chance of having the baby before you are advanced in term is around 20 to 30%. So, these babies might be small and they may not be ready to come to this world. Their lungs and the respiratory system may not be, ready to come out to this world, so they can have problems. There are more risks of infection. There are risks of having, abnormalities in multiple pregnancies. So, the chances that the babies go to neonatal ICU is much higher if it's a multiple pregnancy. So these are the things that PCOS women can have done.
Okay. Well, Dr. Anita, thank you. Thank you very much for this informative session that you've provided us. We now know a lot more about PCOS than we did half an hour back. We know how PCOS comes and the common symptoms that arise with it, the medication. Right now, we do know a lot of these things, but we would be looking forward to a lot more in the coming episode, where we anxiously look forward to hearing more about the diet and how we manage it. In fact, how to prevent PCOS in future, so that many of us don't have, as you rightly said, to come to you. Thank you. Thank you, Dr. Anita. Thank you for watching Conceive.
This program is brought to you by South Infertility and IVF.
South End Fertility and IVF, where hope meets happiness. Established in 2001 and guided by care, ethics and expertise, South End has completed over 10,000 ART cycles. It offers comprehensive infertility treatment for both men and women. Modern facilities and experienced team is the hallmark of South End. The centers are at Vasant Vihar, Gurgaon, Saket, Paschim Vihar and Amritsar. South End Fertility and IVF,